Hello, my name is Dr. Dewan S. Raja. Today I will discuss about pneumoconiosis. Pneumoconiosis include multiple diseases like anthracosis, Kaplan Syndrome, silicosis, and also other occupational diseases. What is pneumoconiosis? Any lung disease. There is anthracosis, silicosis, asbestosis, or exposure to beryllium, exposure to cadmium, and that causes permanent deposition of substantial amount of particulate matter in the lung. What is anthracosis? Anthracosis is a type of pneumoconiosis, usually asymptomatic due to deposition of coal dust in the lung. So this is a lung, and we have a lot of deposition of carbon inside the lung. Okay, those are deposited by the macrophages in the bronchial tree. So these are also called coal workers pneumoconiosis, also called black lung disease. So this is the image of a black lung disease. This is one of the most important member of the pneumoconiosis diseases. Okay, so what happened in coal miners pneumoconiosis? We have the black lung because we have nodule formation. We have chronic inflammatory change. The macrophages, phagocytic cell, will attempt to engulf the dust particle. There is the carbon particle, but they are not successful. And the macrophages die and it is deposited under the pleura and around the bronchus, around the bronchial tree. And there is inflammatory changes is taking place in the lung. There is fibrosis and nodule formation. Okay, in the chest X-ray of a patient with coal miners pneumoconiosis or black lung disease, will get opacity in the lung field, and there is thickening of the pleura because there is pleurisy, and there is entrapment of air. These are called excessive residual air, and this will give black shadow, and the heart will be tubular. So this is a typical example of an emphysema or restricted heart or restricted lung disease, restricted and obstructive lung disease. Okay, that happen as a inflammatory process due to the exposure to the carbon particle in a coal mine. This same appearance may also found in silicosis, person who deal with the silica. Even coal miners may also may be exposed to silica. Okay, so that may give this type of opacity and thickening of the pleura. And tubular heart, a feature of emphysema, flattening of the diaphragm, and excessive residual air, which does not take part in gaseous exchange. We'll get nodule in the lung. We have the peribronchial inflammation. We will get deposition of carbon under the visceral pleura. Okay. So we'll go to the Kaplan Syndrome. What is Kaplan Syndrome or Kaplan's disease? A combination of rheumatoid arthritis and pneumoconiosis that displays as intrapulmonary nodule which appear homogeneous and distinct on chest X-ray. The nodule have central necrosis surrounded by fibroblast, macrophage, and collagen. So this is a chronic inflammatory condition manifested by this nodule. Plus we are getting the rheumatoid arthritis and pneumoconiosis. What is silicosis? A lung disease caused by inhalation of crystalline silicon dioxide. It is also found in mine workers, in construction workers. Silicosis is the most prevalent chronic occupational disease in the world, especially among the construction workers. What job process is associated with beryllium exposure causing chronic fibrotic occupational lung disease? Answer is aerospace and other specialty metal work. Okay, so we are looking at the image from Robbins Cotran pathologic basis of disease. These two images have been taken. What we'll get the advanced silicosis. Lung is transected. Scarring has concentrated in the upper lobe. This is the part, okay, in a small dark mass. Here is that, and there's pleural thickening. Pleura that is covering the lung is thickened here. Okay, so here we'll get fibrotic changes in the lung due to silicosis. So we'll get collagenous silicotic nodule like that. So what is the pathogenesis of pneumoconiosis? What happened? Inhalation of particulate, it may be coal, it may be cadmium, it may be beryllium, it may be silica, okay, it may be dust, may cause lung cancer and mesothelioma with asbestos exposure. In asbestosis, we have no black lung disease. Rather, some books say asbestos exposure causes white lung disease. So black lung disease for the coal, asbestosis causes white lung disease. It is also cause fibrosis, pleural thickening, and there is chance of mesothelioma and lung cancer. Due to exposure to asbestos. Particulate absorb other toxins such as polycyclic aromatic hydrocarbon. Particulates increases susceptibility to pulmonary dysfunction. Okay, emphysema, we have seen the tubular heart and flattening of the diaphragm, and at the base of the lung we found a lot of residual air without any use. Okay, fibrotic lung diseases, so it is both obstructive and restrictive lung disease, and pulmonary hypertension. We'll get less vital capacity, less total lung capacity, we'll get small tidal volume, and we'll get less forced expiratory volume. Deposition of dust particle, dust-laden macrophage around the bronchiole causing inflammation, scarring, and nodule of the lung. Pathogenesis dependent on genetic predisposition. Not all coal miners have the same type of pathogenesis or same progression of pathogenesis. Type and duration of exposure, that is also important, and history of smoking. Smoking will cause more nodule formation, more inflammation, and more aggravation of the pneumoconiosis, more fibrosis and restricted lung disease, obstructive lung disease. Okay. How can we diagnose pneumoconiosis? We must get the history, get the physical examination. We must get the patient's occupational history. We do the chest x-ray, lung function test, as I mentioned, the vital capacity, tidal volume, forced expiratory volume in 1 second, and divided by forced expiratory volume, total lung capacity. It is assessed to find out the lung function test. Rheumatoid factor and antinuclear antibody, this should be done when we suspect patient has also rheumatoid arthritis and pneumoconiosis. Management, it is mostly supportive. If possible, occupation may be changed. Ruling out tuberculosis, statistically found that in many countries of the world, coal miners and other people who work to the silica and other dust has more chance to get tuberculosis. Treatment with steroid, exposure and smoking should be stopped. Management of rheumatoid arthritis by disease modifying medications. and health education, and last of all, lung transplantation. And that's all about the pneumoconiosis. If you have any question, please feel free to ask me. Please share the information with your friend. And I have a book on toxicology that include occupational medicine. Okay, this is the Toxicology Digest book. It is available in Amazon, both in paper form as well as in electronic form. So that's all for today. Please support my channel. Please subscribe me and have a nice day. Bye now.